this week's episode of the W.H.A.T podcast, where we focus on wellness, healthcare, advocacy, and transparency. My name is Lacy Myers, and I'm a second-year doctor of pharmacy candidate at Florida A&M, and this week I'm joined by a very special guest, Dr. Michael Jackson.
Yeah, hi Lacy. Thank you for allowing me to be here with you today. Let's get into our discussion.
Of course. Do you mind just kind of explaining what the upcoming symposium's about?
Right. The symposium is something that's happened over the past 48 years. So our coming symposium that's scheduled for March 6th through the 8th will be focusing primarily on diabetes. And it's entitled the Leonard LeBaron Inge Senior Clinical Pharmacy Symposium. So who is Leonard LeBaron Inge? If you're a FAMU alumnus and you've attended school here within the past 15 or 20 or so years, you would know Professor Inge. He is well known within the pharmacy community here at Florida A&M University, having taught pharmacy law, pharmacy calculations, and other courses as well too. And he's just been a pillar of success when it comes to the development and innovation of continuing education. So this conference was named after him in his honor.
Wow, I mean, this sounds like something we don't want to miss.
Oh, absolutely. You want to be there for that. And I think for this particular conference, we'll also have an opportunity to have Dr. Seth Adler-Deppy, who is the Dean of the Interim Dean here at the College of Pharmacy, to address some, to share some thoughts on some of the things that are happening here at the college. And I'm sure our stakeholders and alumni out there would want to be a participant in that.
Wow, well, this definitely sounds like something that, is very important, something that we definitely need to get involved in. Would you say there's any specific disease states that we're kind of focusing in on this conference?
Well, for this particular conference, we're offering 13.5 hours of continuing education. It's going to be entirely focused on diabetes. Now, you wonder, how can you talk about diabetes in all that time?
Yeah.
Well, diabetes is a complicated disease,
yes,
and it's an important disease when it comes to public health, and it's an area where pharmacists can really make a difference in the care of patients. Just as an example, for example, according to the American Diabetes Association, the national cost of diabetes in the U.S. in 2022 was more than $412 billion.
Wow.
With a B.
Wow.
And those are that's a lot of money that's being paid out for health care. And when it comes to public health, a lot of those dollars are coming from taxpayers. And so what can we do to help mitigate some of those costs? Well, one of the things we can do is find a way to deploy the skills and abilities of pharmacists in the care of patients, these particular patients, because the need is there and there's not enough healthcare providers out there. So why not let pharmacists step in and play some of the roles for some of these patients and help them and coach them through their disease.
Yeah, I mean, that's definitely, like, when you say billion with a B, that's definitely, a very important issue, when it comes to, like, public health and that. So, on average, do you know approximately how many people, have this, disease?
Well, let's just look at Florida by itself. With 23 million people in Florida, and you've got about 100,000 people a day moving into Florida, so to speak. There are 2.3 million Floridians who either have diabetes or have been undiagnosed with diabetes and they don't know it. And that's a lot of people. That's about 10% of the state's population. And in some communities, there are some areas where we have healthcare deserts where the rate's even higher. And so to me, that tells me that there's a demand for care providers who have experience in managing patients with diabetes. And so what this conference is designed to do is to provide a refresher for our pharmacists, because we are already drug therapy management experts, and what this does is it tries to help our pharmacists become even more skillful in this area and more to be able to manage patients who are presenting to them, and to do the kinds of things that need to be done for patients who are struggling to try to manage their disease. It's estimated that when you look at it nationwide, according to the U.S. Census, we have probably about 350 million Americans living in this country, and there are at least 40 million in the U.S. who have diagnosed or undiagnosed diabetes.
Yeah.
And to me, that is a huge opportunity. That's about 14% of the nation's population that have this disease, and many of them are not even being managed. And so the thing is that as pharmacists, we're the most accessible healthcare professional out there. You don't need an appointment to come visit with us.
Exactly.
85% of Americans will walk into a pharmacy at least one time this week.
Yes.
And so they may have a question, they may not understand what's happening to them, so they can talk to their pharmacist. We can help guide them, we can assist them with helping them with self-testing of their blood glucose, helping them with managing their medications and keeping them healthy.
I mean, that's very true. I mean, it's always been known pharmacists are the most accessible, healthcare providers. And when you mention, just educating, even just those viewers out here who are curious, like, do you mind going into maybe the signs and symptoms of, type 1 versus type 2 diabetes? What is the difference? What are those kind of characteristics?
Excellent question, Lacy. And really, when you talk about diabetes, you have two types of diabetes. You have type 1 diabetes and you have type 2 diabetes, and there's a little bit of difference between each one. So, for example, with the type 1 diabetes, that is a situation where you have the body is make sure I get this right because it could be confusing to some folks. You have with type 1 diabetes, you have where the immune system is treating cells in the pancreas, which is intimately involved in the production of insulin, as foreign invaders, and it goes in there and destroys them for type 1 type diabetes. Type 2 diabetes is a little bit different. You might have insulin in the body that's being produced, but the body is, for whatever reason, unable to utilize that insulin. And so you have to treat type 1 diabetes and type 2 diabetes a little bit different for each one. And so that's why we have that conversation there.
Yeah, I mean, that's a very, very understandable and digestible, definition. I think a lot of the viewers out there probably know someone or, have had contact with someone who has that, disease. And I think that this is definitely something that there needs to be more awareness about.
Stakeholders to attend this conference and participate in it. It will be via webinar, so you'll be able to do it from the comfort of your own home. But I'll tease you with a couple of things that might help you to understand the things that we're going to cover during this significant symposium. For example, signs and symptoms of type 1 diabetes and type 2 diabetes are very similar, except for some small differences. So if you're urinating often, or if you're feeling thirsty from time to time, or if you're feeling hungry even though you're well fed and you feel like you're taking in nourishment the way it's supposed to, but for whatever reason you're still coming up, still have an appetite, still want to eat, or if you're suffering from fatigue, or if you have blurred vision. Of course, it could be a number of other clinical things that's happening to you, but these are things that are common that we see with diabetes. Or if you have cuts or bruises that for whatever reason don't seem to be healing right, then that's a sign that you might want to get assessed by a healthcare provider. But the difference when you're looking at type 1 and type 2 diabetes, for type 1 diabetes, you may have some weight loss with type 1 diabetes, even though you're eating more. But with type 2 diabetes, the weight loss may not necessarily be there, but you might find things like tingling or pain or numbness in the hands and feet with type 2 diabetes that you may not get with type 1 diabetes. But you always need the assessment to be done by a healthcare professional to help identify what your problem is. What many individuals will find is they may not show any of these signs or symptoms, but they're progressing into the diabetes area and don't know it.
Yeah.
And even then, they may be experiencing some of these signs and symptoms, but don't want to believe that they are contracting the disease diabetes. And so I would say these patients have deniabetes. And that's where we come in to help say, well, let's take a look at you. Let's find out what's going on with you. Let's run some tests. Let's do an assessment. Let's see if we can find a physician who will do a diagnosis on you, and then once you find that out, come to us as pharmacists and we'll be your coach to help guide you through this.
Wow, I mean, that's That's very, very true. Very, very insightful. I guess my next question would be, will this conference, be able to help us as a whole, just make a difference?
Well, that's a great question, Lacy, and the difference here is that as pharmacists, people come to us all the time with questions about their health, and we're there to answer those questions and help guide them. I can't tell you how many times when I practiced as a pharmacist, I had a patient to come into my pharmacy and say, I've got this going on with me. Could you maybe help me understand what's going on? And I would just sit down and talk to them and say, well, I think you're developing a problem in this particular area. So you have a patient coming to me saying they're feeling thirsty all the time, or they're eating but they're not gaining weight or something like that. And that's a sign that says, well, let's get you referred over to someone who has expertise in this area and see if we can get you going. Then once we get the patient referred and the assessment done, the pharmacist is there to take care of them once they come out. So there are 22,000 pharmacists here in Florida that are registered, that are practicing, that are available to take care of these patients. Mm-hmm. And working with them are about 38 to 40,000 registered technicians who are part of the team that take care of these patients. So, it's just amazing to me that a healthcare professional is nearby to take care of a patient who has diabetes. And for patients that are out there, you're not alone. You have someone you can call on for questions, answers to your questions. And we're there morning, noon, and night.
Very true. I mean, I work in a pharmacy personally, so I know what it's like to be there from 9 a.m. to 9 p.m. And just, do you mind explaining how to enroll in this symposium and what that all entails?
Well, we're working on that now. Hopefully in the next few days we'll be able to open up the portal. For now, may I suggest that you go to the College of Pharmacy's website and search for the Continuing Education Office of Continuing Education. You'll find a lot of our information will be there. We'll have a QR code that will be placed on the site where you can use your smartphones and you can register real easy. And our fees, I can't remember what the fees are. I think around $250, $260 for the full 13 hours, 13 and a half hours. So registration will be real easy, and we're using new technology that once you complete your continuing education program and you fill out a survey form that we have towards the end of each session, you'll be able to report your data into our Office of Continuing Education, and it will use API technology and report your continuing education data directly to the state of Florida and also to the national database CPE monitor, and that'll be done instantaneously. You don't have to worry about filling out any forms. We get that taken care of for you.
Wow, I mean, that's awesome. I mean, with all this technology, it's seamless. You don't even have to jump through all those hoops. You're already accounted for, so.
Yeah, make it easy for you.
Exactly. Well, do you have any last notes or any small message you want to share to any viewers out there listening or watching?
Well, if I were to take a program like this, Florida A&M University has been doing continuing education for a number of years. As a matter of fact, we received a commendation from the Accreditation Council for Pharmacy Education for being a long-term partner in this area. The Florida A&M University has done a lot of great programs over the years in following the leadership established by Professor Inge in developing this symposium, and so we did one last year. We had great attendance and participation with that. We hope that you'll put it on your calendars to be with us the weekend of March 6th through the 8th. I'll be your host for that event. We've got some excellent speakers from not only here within the college, but we've reached beyond the college to find subject matter expertise in the management of patients with diabetes. We even teach you how to facilitate your own diabetes clinic within your pharmacy, and through collaborative practice being able to care for patients that way.
Wow, I mean, that sounds amazing. I mean, who wouldn't want to miss this?
Oh my goodness, I can't wait to see it myself.
Well, that concludes our episode. Thank you guys so much for joining and listening. Please be sure to like, comment, subscribe, and watch the next episode. Have a good one. Bye.